This month's Digital VA is brought to you by Pure Storage.
Employees at Department of Veterans Affairs nursing homes will be some of the first people to get coronavirus vaccines. 4 of the 5 first groups to receive the vaccine at the agency will be frontline care providers. Luwanda Jones is Deputy Chief Information Officer for Strategic Sourcing at the Department of Veterans Affairs. Luwanda, welcome. It's good to see you again. What have you learned from the pandemic about providing IT services and supply chain logistics and so on throughout your area of influence at VA?
Thank you, Francis, for having us, and it's such a pleasure to be here. We have learned so much. First and foremost is the importance of the supply chain, understanding our strategic suppliers of those particular capabilities that we must have. You know, this pandemic affected us globally. Everyone throughout the world needed IT. So we had to understand any and every supply chain risk. So we started meeting ahead of time at the onset of the pandemic to find out about the supply chain, what were the issues, how could we get in front of it, as well as work with our acquisition counterparts. So it was a team effort, working with GSA, working within VA, but most importantly, understanding those suppliers of the critical capabilities and the supply chain risk associated with that. And it's a game changer. We've got to understand the supply chain and be able to be proactive and not reactive.
You used a term there, Luwanda, that I think is fascinating, and that is supply chain risk. When you did that examination, as you just described early on in the pandemic process, what did you learn, if anything, about your supply chain risk that you didn't know before the pandemic?
Well, first and foremost, we learned that, you know, we were always talking to vendors, but I don't believe that we really said, tell us about the supply chain. And you have to understand that when we're looking at IT, globally, everybody needed it. Everybody needed the same type of capabilities. So it was important for us to meet one-on-one with the suppliers to say, what's going on? You know, we need 400,000 end user devices. How are we going to get it? What are some of the things that we need to consider? When we looked at our telework capabilities, we had to rapidly ensure that we had the bandwidth, that the networks, that our gateways were working properly. And it takes a village to do that. And it takes an understanding of each of those suppliers, even at the CEO level of those suppliers, working. I had them on speed dial, Saturdays, Sundays. It was a all-in effort with our suppliers. Speed dial.
You mentioned GSA, Luwanda, and it strikes me that the partnerships that you establish with organizations like that all over government with potential acquisition partners were probably tremendously valuable, weren't they?
They had to be. For example, we were going through a protest, and we had to get an override of one of our protests for some critical supplies that we need. And so we had to work with GSA to talk about VA's priority in the supply chain. We had to talk about working to get a protest override. It was all hands on deck from a federal government perspective. VA, we are the largest healthcare provider in the United States. And our fourth mission, we had to educate our suppliers on VA's fourth mission of providing health care to our civilian counterparts. It could be your cousin, it could be my cousin. Then they may not be they may not be a veteran, but when the public hospitals become oversaturated, our fourth mission is to provide that capability. And so we had to ramp up for that.
Luwanda, we have less than a minute left. What have you and your team put in place as a result of the pandemic that you expect to keep moving forward?
Constant working with our suppliers. I cannot overemphasize the importance of supply chain risk management, the importance of vendor engagement at the highest level. We've done vendor engagements for years, but the up-tempo that we're seeing in this pandemic is just, it's magnificent. And again, supply chain management, we have to do all hands on deck from a whole federal government perspective, not just VA, but this is a federal government initiative globally.
Luwanda Jones, thanks very much. It's great to have you back.
Thank you. Thank you. And it was great being back.